Gene therapy has enabled numerous deaf children to experience hearing for the first time. This remarkable achievement is being acclaimed as a pivotal game changer, giving optimism for the potential emergence of the first revolutionary treatment for hereditary deafness in decades. This good news is for people suffering from hearing loss due to hereditary conditions. This means one or both parents have a gene for deafness condition transmitted to their children. Importantly, two modes of genetic disease transmission are dominant and recessive. We all have two copies of the same gene, one from the mother and the other from the father. In dominant, even if one parent has a diseased gene, that will manifest the disease. However, in recessive conditions, the disease is manifested if both parents transmit defective genes. A fascinating story of defeating hereditary deafness has been reported from the Children's Hospital of Philadelphia. An 11-year-old boy, Aissam, was born deaf due to a single gene mutation. In October 2023, he became the first person in the US to receive a gene therapy that added a healthy version of the mutated gene into his inner ear. Within 4 weeks, he began to hear sounds. Gene therapies that let deaf children hear bring hope to people who have hearing loss. If someone gets defective genes from either one or both parents and suffers from a condition like hearing loss, it can be treated. Besides the story of the 11-year-old boy from Philadelphia, 5 deaf children in China overcome their hearing loss and start communicating verbally without a cochlear implant. All these children received gene therapy protocol using adeno-associated viral vectors. The hearing loss disease condition treated as deafness, neurosensory, autosomal recessive, also called DFNB. 75% of autosomal recessive cases, Otoferlin, gene OTOF, defective protein is responsible for DFNB9. A mutation that is a change in the genomic material. The DNA in the OTOF gene cannot produce fully functional Otoferlin protein required for sending sound signals to the brain necessary for hearing. Remember, humans are diploid, meaning each parent transfers one gene, and children possess 2 copies of the same gene, one from the mother and the other from the father. These genes are also known as alleles. We have used the scientific term autosomal recessive, that means it is an inheritance pattern in families with a genetic disease whose gene is not on a sex chromosome. Patients affected with autosomal recessive diseases have a disease allele on each chromosome, meaning the mother and father transmit the affected gene. I want to elaborate on the other term used in the presentation, which is gene therapy. Sometimes, humans inherit specific defective genes from their parents, causing a particular ailment, such as hearing loss due to defective Otoferlin gene. Replacing those genes with the corrected one in the human genome or using vectors to express the gene product in the cells could overcome the defective gene problem. This is known as gene therapy. Regarding this good news about people being treated for hearing loss, several genes are associated with deafness among humans. One such gene is the OTOF gene. This gene encodes Otoferlin protein. A person having defective OTOF genes from both parents has hearing loss needing a cochlear implant. The disease condition is known as Autosomal Recessive Deafness 9 and only happens if both parents have transmitted defective genes. You may like to know what protocol was used. This data is from clinical trials that are very scientific in nature. Individuals suffering from hearing loss due to the OTOF gene were injected with a viral vector comprising adeno-associated virus serotype 1 carrying the normal OTOF gene into patient cochlea. This results in the production of normal Otoferlin protein, ultimately restoring hearing loss. We will talk more about this invention and elaborate on gene therapy. Remember, gene therapy is always highly specific for correcting a particular gene defect. There are almost 26 million people in the world suffering from hereditary hearing loss conditions, also known as congenital disabilities. Moreover, in this gene therapy, the defective gene for Otoferlin is corrected, leading to recovery from deafness. Future studies will explore several other genes that also lead to deafness. Thank you for watching this video. We appreciate you for your comments and request for subscribing to Biomedglobal.